Thanks to New Teeth now, I can smile and I can live a healthy life. Today I got my final teeth in and I am so excited. I can't wait. I would never eat with my front teeth. Everything was either broken into pieces and put to the side. I would never bite into anything because whenever I did, they would wiggle and feel loose. So I was afraid to do that. I had loose teeth, periodontal disease, and I knew that I couldn't do dentures. I knew that I wouldn't be comfortable in them. I would never be happy. I had been to other dentists and they had told me within 5 years you're going to lose all your teeth and you have no bone to support your teeth. I researched and New Teeth Now came up on my computer and I was reading about the zygomatic implants. All I heard was it's good for no bone. I said, I think this is the place we need to go. When I met with Dr. Kirkpatrick at my consultation, made me feel very comfortable in this decision that I was making to change my life. I went in, I woke up a few hours later. Relatively easy, I guess you could say, because I don't remember it. But believe it or not, I did not have any pain, none. I myself was shocked and I was the one going through it. I think I held the mirror at New Teeth Now for like 20 minutes and when they took it away, I said, no, give it back. New Teeth Now changed my life in one day. My doctor believed that getting rid of my teeth and my periodontal disease had a major, major factor in my health being what it is now. She's like, if I could call New Teeth Now, I would personally. If you have periodontal disease, loose teeth, bad oral health, just make a phone call and go to the consultation. And it will definitely change your life, but you have to make the first phone call. It's life-changing, it's amazing. I couldn't be happier right now.
Everyone, and welcome to the New Teeth Now webinar. My name is Bianca and I'm here with Dr. Kirkpatrick.
Hey, Bianca.
And as you saw from this first video with Michelle, we are going to be talking all things full mouth dental implants and how it can change your life. So,
absolutely.
Yeah.
Can I borrow the little
Yes, this
clicker?
is your, yeah, that's yours.
All right. Well, thank you guys for being on here. I know it's a Tuesday night, and if you're here in our Central Florida area, it's a lot colder than it usually is for this time of year, but it's a perfect time to be inside.
Yeah, snuggle up.
Learning about implants.
Yeah.
You know?
Perfect.
Okay, so we'll jump right in it. All right, so I think it's a really good way to start the webinar by showing Michelle's video. She does a great introduction about, what this can do for people and how if you're in a position where you need implants, she kind of explains what it, especially for her personally, what it means to be able to get out of the condition that she was in, get implants, and a very healthy, pretty smile, as you saw, that we all saw her eating the pizza. And that is a very important thing for people to be able to do. All right. So there's her after, and she looks absolutely beautiful with that smile. And so a little bit about me. I'm originally from Kentucky. Did all my school at University of Kentucky. Except for surgery, I did at University of Florida. And I am a board certified oral and maxillofacial surgeon. And that is a very important thing for you to hear tonight. And when you're considering who's going to be treating you with a procedure like this, you really want to make sure that the person putting the implants in or doing the surgery is a board certified oral and maxillofacial surgeon, or at least someone who has a lot of experience doing this type of procedure. You definitely do not want to go to someone who does like one a month or one every other month of this type of procedure, because we do unfortunately see some really bad things that need to be redone, and it's always harder to fix it once it's messed up, and it's a lot easier to do it the right way the first time. So our office is located in Lakeland, Florida, which is very conveniently located between Tampa and Orlando. So if you're coming in from out of state, it's super easy to get to. You can fly into both airports. They're major international airports and very easy to get to Lakeland from both of those locations. So the surgeons here that do this procedure, of course, me and my partner, Dr. Harley Richards, he has been placing implants since actually the 1980s, which is super cool when you think about it. So he's got a lot of experience. And I've been here since 2007. And together, we pretty much do one of these cases a piece every day. And that's a lot,
Yes.
considering all the other clinics that try to do this procedure. We're very blessed to be able to have patients continue to come in and seek not only this type of procedure, but to get it done from people who have the experience and just a lot of different techniques and skill levels to treat almost every patient.
Because you've probably seen everything you could think of over the years, or most everything.
Yeah, you know, I mean, we have seen a lot. I don't know if we've seen everything, but we've seen a lot of different things, from people coming in with different conditions with their teeth, with no teeth, with missing bone from trauma or a tumor that needed to be removed, or people that come in that have gone like out of the country to have this procedure done and it ends up being a disaster, and we end up trying to fix that.
Yeah.
And those can be super challenging cases, but we do see those, and we do a fair number of redos. But what we're going to do tonight is talk to people who've never had this procedure done, and you're coming here for the first time to get it done the right way the first time.
Yes, that's what we
Exactly.
want.
All right. So what do we do different, and what makes us different than other clinics that do this type of procedure? Well, there's these three key differentiators that we talk about quite a bit. As I mentioned earlier, we are both board certified oral surgeons. The zygomatic implants, those are a specific type of implant that goes into a specific type of location to anchor and give you a ton of support to hold your bridge in, especially on people who do not have enough bone to do regular implants. So if you've ever been told that you do not have enough bone to do implants, you really need to call us and come in for a consult. Since I've been here since June of 07, I have yet to have a patient that I could not treat with this type of procedure using the zygomatic implants because they didn't have enough bone. The only time I've ever had to really turn a patient away is just because they could not undergo the procedure from a medical reason. So they just weren't healthy enough to undergo the general anesthesia, which that's the third differentiator, is general anesthesia. So every patient that we do this procedure on, they're placed under general anesthesia. So we have a separate anesthesia team, and they do all the anesthesia part while we focus purely on the surgery. Now, a lot of places will say you're under anesthesia or you're asleep for this type of procedure, but if you really know what you're talking about when you're inquiring about how they're going to be treating you, then one thing you want to ask is it an IV sedation or is it general anesthesia? Because a lot of people will say you're going to sleep, but it's just an IV sedation. And that is a totally different game than being under general. And a lot of times with the IV sedation, it is the operator, like the surgeon or the dentist that's putting the implants in, is also doing the IV sedation. We have a separate anesthesia team, so their total concentration is on you from an anesthesia standpoint to make sure it's the safest way possible, and then we're focusing on the surgery.
We did have a good question about general anesthesia. What could be some medical reasons that you couldn't do surgery?
Well, there's not that many, but there's a few that are very serious things. Some malignant hyperthermia, if you've ever had a reaction to the anesthesia, if you've had a family member who's had a reaction to the anesthesia, then it doesn't really mean it's absolute that you can't do it, but we may have to do the procedure in a hospital setting. And then there's some patients who just are not heart healthy enough, so your heart or your lungs play a major role in obtaining medical clearances to make sure that you're healthy enough that you can undergo a couple hour general anesthetic and be placed on a breathing machine, while because you're totally out, just like you would be for any other outpatient surgery. It's the safest way that we can do this, where we've got total control of your airway, and then we can use enough irrigation and not worry about anything falling into the back of your throat or you not being able to breathe, because we've got some gauze, guarding and protecting your airway. So we just put a breathing tube in, our anesthesia team does. That way we can do whatever we need to do to get you the best possible procedure with the implants. And so, but heart, lungs, those are kind of the two big ones. Because if your lungs are not really healthy, and there's a good chance that after you wake up from general anesthesia that you'll need to be prolonged on a breathing machine for a day or two, then you're probably not healthy enough to have this done in an outpatient setting. Yeah, but those are good questions. And keep those questions coming, like Bianca was talking about.
Yes, I didn't mention that, but yeah, write in any questions in this chat and we'll be able to see them and answer them for you today. That's a big part of why we're here. So
yeah,
Dr.
absolutely.
Kirkpatrick is here.
We're here for you. I want to try to get you some information, but if you guys have questions, definitely shoot those over and we'll answer them live here on the webinar. So how do we do this? Well, with the upper jaw, there are specific areas that we look at to put implants, and usually 6 implants is the gold standard. And you can kind of see this artist rendition with the implants kind of ghosted in what should be the bone there, with the bridge screwed into the implants. So there's typically 6 screws or implants that are placed in the bone, and then the bridge is screwed into those implants. And then the lower is very similar. The lower jaw, 4 to 6 implants is gold standard for the lower. And you can see how they're positioned here, and the bridge is placed on top of those little posts that are sticking up out of the implants. They're called abutments, and the bridge is screwed into those abutments. So people who do not have a lot of bone, this is how we would treat someone in the upper jaw that really either their sinuses have enlarged or they just do not have enough bone in the back part of the upper jaw. And you can see those longer implants are anchoring into the lower part of the cheekbone. And then we use those to provide a foundation that the bridge gets screwed into, like you just saw there with those small titanium screws. So it works really well every time. Yeah, and I think that's the cool thing about this, is it's very predictable. And when you come in for a consult, then we're going through your CT scan with you. So you're actually seeing your 3D CT scan, and I'm showing you where your implants will go. And while I'm doing that, I'm also kind of registering mentally and with our implant coordinator, they're taking notes, that where you've got good bone for implants, that's what I'm going to use. So as I'm talking to you and showing you what you have that's going on around your teeth or the bone that you have left that I can place implants in, I've got a really clear picture of exactly what I'm going to do for you in surgery just by going through the consult with you. So this technology has really helped us. With the CT scan and the digital scanners that we have, we really know what we're going to do before we go into surgery, and there's no more impressions. Yeah. Like, that's the super cool part about the technology that we have now too. People would, there's the impressions, the old putty stuff they'd mix up, put in, it may go down your throat a little bit, stimulate the gag reflex, and a lot of patients just had a hard time tolerating that. Mm-hmm. Now we don't have to do that. We've just got a tiny little camera that kind of quickly runs across the upper jaw, the lower jaw, and then we have a digital record on the computer screen that we send to the lab, and that's how they design your teeth. So it's very cool.
It is.
So a lady that I treated with these zygomatic implants, she came in from the northeastern part of the U.S., and she knew that she did not have enough bone once she lost this bridge. So what you see with her upper jaw there, that's one big horseshoe-shaped bridge that's cemented, or it was cemented, on the remaining 5 or 6 teeth that she had. They started to fail, the bridge started to get loose, and she was really worried and scared that she would be at work or out with friends and this bridge would fall out. So she tried to find someone to do implants. She was told she didn't have enough bone for implants. So she came down to Lakeland because she heard about our zygomatic implants through Google. Thank you, Dr. Google. And one of the best referrals ever. And we were very easily able to treat her with implants and just using one zygomatic implant on each side and in the back. So it was a very straightforward case for us, but I could see where without zygomatic implants in your box of toys that you could use to help patients who do not have enough bone, then you're very limited on either this patient can't have implants or she needs some type of bone grafting to lift the sinuses and create enough bone to put regular implants in. And sometimes those they work well when they work well, but when they do not, it's a disaster. But with the zygomatic implants, they typically work every time the same way.
And the process is like much smoother than doing
Yeah,
sinus
and
lifts
it's
and bone grafts.
one procedure instead of doing the sinus lift and the bone graft, waiting 8-9 months for the bone to harden enough to be able to put the implants in. We don't have to do that.
Yeah.
So we don't even have to do the procedure. We don't have to wait on the bone to heal. We can just put these zygomatic implants into the lower part of the cheekbone and you get teeth same day.
Yeah, that's incredible.
Yeah,
That's
it
like
is. It
number
is
one
very,
reason
very cool.
to get zygomas.
Yes. And for people who really just do not have hardly any bone in the upper jaw, front or back, then that patient would be someone that we would do what we call the quad zygomatic implant case, where we do 4 of the zygomatic implants, 2 on each side. There's 1 in the back, 1 in the front, and then 1 in the back and 1 in the front on the other side. And these are a very strong foundation to support the bridge. We don't just jump in and do these on people who have enough bone to do a regular implant, but if you do not have enough bone, then these are a true saving grace for that patient and give them the ability to be able to have implants and not have to think about or worry about a denture.
We did have a question come in, which we're going to talk about more in depth,
Okay.
but Anne was asking, from start to finish, what is all involved in getting the right implants that will fit perfectly in my mouth, and how many visits would it take before surgery?
Okay, that is a very good question. And it's such a good question that we have a slide to talk about that process a little later in the webinar, but I'll kind of briefly go over it. So there would be there's 2 appointments. Your first appointment would be for a consult. You come in, we just go over your scan, I do an oral exam, we talk to you about the process, the procedure, and then we review your medical history. And then once we do that consult, your next visit is the visit right before surgery, where you would come in and we do the scanning. So we'd scan your upper and lower jaws and talk to you about what you ideally would want your temporary teeth to look like, and then the lab starts designing and building those teeth. That usually takes about a week to make those teeth. So your surgery could be anywhere a week or more after that scanning appointment.
Mm-hmm.
And by the time that you come in for that scan and it's time to do surgery, a week is kind of a good time frame, just because for scheduling purposes and for you to get everything lined up. So if you're out of state, we can help you with hotel arrangements, travel arrangements, and things like that. But it usually is within a week. And then for our out-of-state patients, if you know that you're doing this procedure, then we really can curtail some of the appointments for your travel needs. So we can combine some of those where we would do the consult, scanning same day. So who's a candidate if you have no teeth or you're unhappy with your dentures? Mouthful of bad teeth, severe periodontal disease, which is gum disease, or if you've ever been told that you do not have enough bone for implants, you're definitely a candidate for our New Teeth Now procedure. And then once again, these 3 key differentiators, we keep going over this because we feel like that these are super important and they really set us apart from most other places that are doing this type of procedure. And we feel that these 3 things make it where It's safer for you as the patient, and it's easier for us as the surgeons, and we can treat almost everyone with the zygomatic implants. So our implant coordinators, once you scan that QR code, call the 800 number, or go onto the website and you make that attempt to schedule a consult with us, you will be seen by one of these three young ladies, and they're all three excellent. They're very, very knowledgeable with this procedure. They've all been assistants, so they've kind of been there, done that, and seen this procedure, so they really can talk to you with a lot of knowledge about the procedure, the process, and all the steps that you would need to take to get in here to have this procedure with us.
Yes, if you do scan that QR code, you can schedule a phone consultation if you don't want to come in person right away. But you could also call the 800 number, and Lisa's on the phone right now. She can set up a consultation, an in-person one for you. So call the number if you want an in-person, and then QR code is if you just want to start on a phone call.
Yeah, thank you for correcting me.
No, you're good. I just wanted to make sure
perfect.
that we're at the right spot, you know?
And then our two restorative doctors, Dr. Nafala and Dr. Dibbs, they have both been here for years and years with us, and both are excellent, both have a tremendous amount of knowledge, and they have kind of seen anything that you can think of from a dental standpoint with either what patients are coming in with and what patients are going to leave with their New Teeth Now bridges. And Dr. Dibbs later will be sharing a video, actually in a few minutes, that's talking about just what it means to him to be here and part of our team where we're all under one roof. And I'm going to let Dr. Dibbs take it away.
My name's Elliot Dibbs. I am one of the restorative doctors at New Teeth Now. I've been here for a little over 12 years now. I guess one way to look at it is sort of the surgeons are creating the foundation with the implants, and the restorative doctors are building the house on the foundation. One of the things that really sets New Teeth Now apart from the other offices that are doing full mouth implant reconstruction is that I have my own laboratory here on site that myself and the other restorative doctors are able to use. And this is absolutely invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of this as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood, and because of the emotional concerns that they have, we really have to spend the time with the patients. You cannot rush anything. I will show the patient the colors, I will review which ones are more natural looking or less natural looking, and the patient's going to make the decisions. They may want to change the aesthetics, they may not want to change the aesthetics, they may only want to change the color of the teeth. Whatever the case is, we're able to communicate that to the laboratory. I get emails daily from my designers that gives me a 3D design that I can review the new design and the changes that we made prior to the lab proceeding. So they're not going to move from my discussion with the patient and records gathering to a subsequent set of teeth without my approval of the design. It's something that's extraordinarily complicated that we just happen to make look pretty simple in most cases.
These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I just don't know of any other office that's like this.
So it is great to hear from Dr. Dibbs, who could be your restorative doctor, and how he works easily with the lab, and it's just better outcomes for everybody.
Yeah, no, it's great. And it's, you know, he hit on a lot of good points. But I think just having everyone here in one roof, where the lab, the restorative team, the surgical team with us, the assistants, I mean, everyone is here. So if he does have a question, it happened today. You know, he had a patient that had this procedure done a few years ago, and they were here for a cleaning appointment. And he's like, hey, I was seeing this. Had really nothing to do with the implants. It was just an area he saw in the mouth. And we had some time so we could just run up and check on it. So it's great for the patients. And it makes it easier for us, so we don't have to keep bringing you back in at, hey, tell them to come back tomorrow if I can just run up today.
We had a couple questions that I think would be a good time to answer them.
Okay.
So
perfect.
Patricia said, I have had a brain aneurysm ruptured twice in 2013, but I have been released by my neurosurgeon in 2024. What would I have to do?
That's a great question. So it's pretty much whether you've had something like you've had in the past with a brain aneurysm, we would just be in contact with your neurosurgeon or what other specialist you would be seeing and make sure that they're okay and they understand what we're planning to do, especially more from the anesthesia standpoint. It's not really for medical clearance for a dental implant. It's more for the general anesthesia. So we've got a typical letter that we would modify for your specific situation and send that to your neurosurgeon. So yeah, it should not be a problem. As long as they're okay with it, we're okay with it.
And then Pete was saying he doesn't have a primary doctor. What would you recommend for him to get a medical clearance? Like, how would he go about doing that?
So that another good question. Depends on, when we're going over your medical history with you and some more specific questions that may lead us down different roads, just when we're talking during your consult. But either we would recommend you finding a primary care. If you're around this area, we can help you with that. And we've got a couple people that are more than willing to see you for some of the medical clearance procedures. But if you're healthy and you don't have a primary care and there's really no other reason for you to go to see one before surgery, I feel like that everyone kind of should have a primary care doctor. But if you don't, I don't necessarily need that. I may just need to schedule you and give you an order that you can take into any, like a Quest or outpatient urgent care. They could do an EKG and basic blood work, and that's what we would need for your medical clearance.
Last medical clearance question. Lots of
Perfect,
these.
yeah.
For someone who's out of state, how would that work? If they come down to have the surgery all in one, time.
Yeah, and that happens a lot. So we, our coordinators, the three ladies that you saw there with Allie, Shauna, and Chastity, they definitely are super knowledgeable about getting everything organized, because the last thing we want to do is have you have everything in your life on hold and scheduled to come do this, and then you get here and we can't put you to sleep. So we really kind of have the system down, and they can talk you through that process of everything we would need before you ever come to Lakeland. Mm-hmm. So we'll have it all set up, and we know
we
we're
walk
going.
You through everything.
Yeah. So we have a lot of patients that come in that same situation.
Perfect. And there's a question about timelines, but I think the next slide will cover a lot of that.
Yeah,
so hopefully that will
okay.
be answered then.
Yeah.
Perfect. Thank you,
Keep
guys.
them coming. Those are
keep
great
them coming.
questions.
Yeah.
So this is me and my staff. So these two ladies, they've been with me for years, and they have a significant amount of experience with dealing with patients going through this process, answering questions, they are like just extensions of my hands. They really are. They're usually a step ahead of me in the surgical procedure. So they're kind of paying attention. They know exactly at what stage we're on in the surgery, and they've got everything ready for that next step, which makes my job a lot easier, and it makes it really more efficient for everyone involved with getting you through the process, which makes it better for you, the patient, to have a lot of experience, people around you, no matter what position they're in. And then the process, we've had a lot of questions on this. So first appointment is for the consult with one of our implant coordinators. The second appointment is the pre-op and impressions. That's where we do the scanning and you pick out what you want your temporary teeth to look like. And then the next appointment after that is the actual surgery. And then the post-op and adjustments, we kind of go through that process as you are healing. So if you are doing really well, I may not need to see you as much. If you're not, or you've got a lot of questions, I will see you anytime. So at any point during the recovery process, if you've got a question, you don't think I just don't know if this is normal, then you come in, I'll see you anytime. But typically we would see you about a week after surgery, and then somewhere a week or two after that, which is where we actually are doing a really cool thing for our patients where your temporary teeth are actually made out of zirconia. So that is the final teeth that most people are just making for your final set. But we're doing that for your temporaries and your final. Yes. So we make you, surgery day is a 3D printed set of teeth. And then within a couple weeks, we're swapping those out for zirconia temporary teeth. You'll love that. We love it because your gum tissue heals really well to it and it's super strong. So it kind of braces the implants, allows them to heal a little bit more predictably. And you'll love it because it's the final material. It is super strong and it looks really nice. So patients have loved that since we started doing that a few years ago. And then we let you kind of finish through the healing process. And once you reach that 5 to 6 month mark, that's when we start making your final teeth. So it's just a second set of zirconia teeth. And the reason we do that and we wait 5 or 6 months to make those is because that we want you to get through the process of your gums going through the shrinkage phase. Everyone goes through that process. The day we do this, those teeth are made to go up, kind of butt up and touch the gums. As you heal, your gums get to a happy, healthy position. They shrink down, tighten up around those abutments, and become really healthy. But you develop a little space in between your gums and your bridge. You're not going to truly like that space. We know that. But the only way to fix it is to wait until that shrinkage totally settles, and then we make your final teeth to go up and touch the gums again. That's how you get the most custom, best fit for your bridge. And that's what it's all about at the end of the day, for you to have the best bridge in your mouth that gives you something you're not only looks really nice, but you're comfortable with and you can eat and just enjoy life. And then the care and maintenance. So just like we would do if you had natural teeth, come in every 6 months for cleanings, you do the same thing with these type of bridges. So we've got another patient who has a really neat story, but he's got a video that we're going to let him go through the process. I think we have yes, we do. Okay, I got confirmation. I'm glad because I like his video a lot. But Mike does a really good job kind of talking about his specific situation and what he went through here with us at New Teeth Now. A really good question. And I actually had a patient. He was very, very anxious. One of the things he did, he got online the night before his surgery, watched a zygomatic implant procedure, and he no-showed the next day. He stood me up. He literally stood me up. I'm here, I'm ready, the team's ready, we've got the room ready, anesthesia team's here, and there's no patient.
And
he couldn't believe you stood him up.
yeah, and I stood him up. I stood him up. He could have kicked me to the curb, but he didn't. And I'm very thankful that Dr. Patrick did not do that. Because I'm here today smiling
With your new teeth now.
with my new teeth now. Then I was diagnosed with periodontal disease, and I basically gave up. That's when things started going bad. Quick. They were just falling out of my head. When I held my grandson, he's 2 years old, he would look up at my mouth, and he would look down and shy away. My mouth scared him, and I knew I had to do something.
He actually found Dr. Kirkpatrick in New Teeth Now, but I knew that his anxiety was still going to be a problem.
And he looked over my CT scan, and he explained everything to me. so I can understand. I was impressed. I felt comfortable with him, and when we left, I was excited. For the first time, excited to get this finally behind me. Well, we went through the consultation, everything went great, and the day of surgery, I was nervous. And at 7 o'clock, when I was due to be there, we called. I canceled an hour before I was supposed to be there. And I felt horrible, but I saw the next webinar, and he was telling my story.
And one of the things that scared him was he watched a video of, some clown trying to place a zygomatic implant that probably had no business doing that. And it's nothing like what you would experience here.
But we called back, and they put me back on the schedule. Day of surgery. I went into the bathroom, they gave me my gown to change into, and I started having a panic attack. I went up to the waiting room, grabbed Debbie. We have to go. So she's all confused, not knowing what's going on, and we get in the car, and I was like, I just need to get out of here. And I look up, here comes Dr. Kirkpatrick out the side door, looking all confused and concerned, and he said, what's going on? I was like, I'm just having a panic attack. I can't do it today. He's like, well, come out here and talk to me.
You're already here.
You're already here. So I get out, talk to him. He's like, you need to do this procedure, but I will walk you through everything. I got you.
For a doctor or a dentist to come out to your vehicle and walk you back in somewhere,
Yeah.
not because they want the money, not because they want anything other than what's best for them.
He really cared. He really cared. And I
He
trust.
showed how much he cared.
Yeah.
Nobody has ever done that before. I love him. I think he's great. I think he really cares about his patients.
He does.
And I wouldn't have this today if it weren't for him.
Absolutely. Absolutely.
I think that it's better for so many different things. I mean, you get more kisses, you get more hugs, you get more talking, you get more smiles, you get better pictures. I mean, definitely changes so many things.
We go out to dinner. We're more active with the family and friends, and I feel comfortable. I'm happy. I feel great. And I'm excited about the future. And I can't wait to start traveling with my wife.
You have everything to gain.
Absolutely.
And New Teeth Now, you get it the same day. You get a doctor that really cares.
And they don't treat you like a number.
No.
They treat you like a person. And that's what you get at New Teeth Now.
Story. I just think it's great.
Yeah, it really is. And it's, I guess kind of sadly, but in a really cool way, it's all true. It's
Yeah.
definitely true.
Oh yeah.
And unfortunately, we do have a lot of patients, and that's how some patients end up in the condition they're in. They just truly are scared
Yeah.
of the dentist, and then all of a sudden they're in a situation where they're forced to do something, and that something usually is a procedure like this. And thankfully, under general anesthesia and just the way that we handle the dental chickens here, we can get you through this procedure.
And a lot of our patients are like that, so it's not like
Oh yeah,
you can
no.
be comfortable. Like we've seen everything.
You're in a club with a lot of members if you fit similar to his situation. But his after picture, I know he kind of showed it in the video, but he just looks great.
Mm-hmm.
And they do not they just look like he's
look
had
natural.
braces and maybe his teeth bleached a little bit, but they look really, really good. And he picked those, and I love the color.
Oh, go ahead.
No, go ahead.
I was gonna say we had a good question about
Yeah.
the whole shrinkage process that you were
Okay.
talking about. So Jennifer said, with the shrinkage process and the space between the gum and teeth, can you walk me through what it would look like as far as speech and eating, etc.?
Yeah, so it's really nothing that you can see unless you really took your lip and pulled it way up or the lower way down. No one will be able to see that, but you definitely can feel it. As far as like eating and maybe speech, that's what we would hear. Those are the two comments that we hear the most. Things easily get stuck there, but on the flip side of that, things are easily like rinsed out. I mean, even just swishing your mouth out with water after you eat, most of the time you can get that stuff out. Or people tell us that they'll just carry a toothbrush with them, or brush, after you eat, and it's very easy to clean. As far as the speech, everyone's different. For the most part, I don't think people even really comment because we talk about that space so much in the consult. And then the restorative team, when you're here for the scans to design your temporary teeth, they go over the space that will form. And I think we talk about it so much, patients are really expecting it to be bad, and it's not, and they just kind of fly through it.
Yep.
And there's a few patients that they'll tell us, when I can see them during the recovery at some point, and we're like, yeah, when I say certain words, and it's usually like the S or T, because your tongue hits the back part of your upper front teeth to create that seal and make that sound. And if there's a gap in between the bridge and the gum, maybe a little air can escape over it, and you have like not a true lisp, but more like a hiss with those sounds. But the people that make a comment about that it's hard for them to make that sound, they will, by the time they're ready for their finals and they're doing the graduation day from the surgical side, they don't have it anymore, because they've really focused on pushing their tongue more to the roof of the mouth to create that seal T. And, they just change the position of where their tongue hits, and then that goes away. But then once we do the final teeth and we kind of make them more custom to go up and touch the gum again, for the most part, that completely goes away. So it's one of those things that it's mainly during your temporary teeth, and it's pretty
You'll
easy
adjust
to adjust to.
Yeah, that's perfect. How long does it take to get an appointment? That's perfect. Our number here at the bottom of the screen, Lisa is on the phone. She can go ahead and set you up a consultation tonight, and you can go ahead and get, write it in your calendar and come on and visit us. And if you are out of state or just want to start with a phone consultation, the QR code on the screen or in the description, you can schedule that phone consult right now as well. So it is pretty simple just to take that first step, which is sometimes the hardest thing to do, is just to take the first step.
Yeah, it is. Coming through the doors. Any other questions yet? Or should I
Lots
keep
of
going?
really good commentary tonight. A lot of this I'll be talking in the next couple of slides, so just hang tight, guys. Just a couple more slides, and we'll talk about pricing and insurance and all of that.
Oh, yeah, perfect. All right. And actually, I'm going to let you take it from
right.
here with the resources.
Perfect. So we have a lot of great resources even after this webinar that you can check out. Our New Teeth Now community group on Facebook. So if you were to type that in directly onto your Facebook search bar, you can join this group. There's over 800 members. A lot of them are patients that have had the procedure or are currently undergoing the procedure or just need some advice and are kind of researching. And you can ask real patients questions and get their feedback and see the posts that they've made. It's a really awesome place to learn more about this awesome procedure. And then on all our social channels, Facebook, Instagram, YouTube, TikTok, we have good before and afters, videos. You can also DM us on any of those platforms, and we will talk to you there as well. So if you have any other questions, feel free to message us. You can also message us on our website. So we have lots of ways to get in contact, and we're just here to help answer your questions and help you take that first step in consultation and hopefully maybe change your life. We can wrap up tonight with a last question. So if you have an autoimmune disease, can implants still be done?
Yes. Implants can be done with autoimmune diseases. We, of course, would walk through the specific disease that you're dealing with and any medications that you are currently on, that you have been on in the past, and see if, just to make sure that none of those would affect how the bone actually fuses and bonds to the implants.
Perfect. And I totally forgot to talk about insurance. So if you have any dental PPO plan, that can be applied towards or reimbursed after surgery. And then for financing options. We have a lot of different financing options. If you do talk with Lisa tonight or call someone tomorrow, they'll be able to walk you through those, and you can even apply online on our financing page. So hopefully that helps with that. But yeah, I think, do you have anything else you want to add tonight? We had a great turnout.
Yeah. I mean, it was a great webinar. Hopefully you got your questions answered. And if not, definitely call in, because the people on the phones, they are here for you to answer any questions that you maybe had problems submitting. But definitely, if you're thinking about this, just schedule a consult.
It doesn't hurt.
No.
Yeah.
And you will find out more about what's going on with your mouth and the facial bones, and you'll get to see them on the screen. And even that part's cool. So just come in to look at yourself on the screen.
Yeah.
In the 3D skull.
Yeah.
Because a lot of patients, when I'm going over it, they'll be like,
It's pretty
"Do
crazy
you care
to
if I
see
take a
your
picture of
skull."
that?"
Yeah.
And I'm like, "Yeah, no problem. Here, let me put it in a good position so you can get a great picture." But no, it definitely would be in your best interest if you're considering something like this, or if you just question, like, do you need it?
Yeah.
Come in and we can talk to you, because we do this procedure all the time, but us here at New Teeth Now, nor anyone else in the world, has anything that's as good as your natural teeth, if they're good. But if you do not have good teeth, or you're missing teeth, then this is the best way to replace your missing teeth. So just come in to see if you're a candidate.
And one more time, if you did want to schedule the phone consultation, I'll leave this slide up here so you can screenshot the QR code, or this is the actual website, newteethnow.com/phone consult. So go ahead and set that up. It does not hurt to do that. All right, thank you guys so much for joining us. We hope you have a happy Thanksgiving in a couple of weeks, and everyone have a wonderful evening.
All right, see you guys.